Maria is enjoying a day in the dog park with her dog Maggie when, hey, who's this friendly fellow?
Hi there. Don't mind Bubba. He's friendly.
Well, hi, Bubba. Maggie won't mind. She loves making new friends.
Hi, Maggie. I'm Chris.
Hi, Chris. I'm Maria.
Nice to meet you both.
She loves belly scratches.
Can I ask you what that tattoo with the green X means?
It means Maggie has had an ovary-sparing spay, so she doesn't get pregnant. But she keeps her natural hormones and the health benefits they provide.
Very interesting. What do you mean about hormones and health benefits?
Well, traditional spay and neuter remove the ovaries or testicles, which produce hormones. But research shows that keeping those hormones can reduce the likelihood of developing ailments like joint disorders, cancer, obesity, and incontinence.
Yikes! I never knew that spay and neuter could have bad side effects. So, how do they do an ovary-sparing spay?
It's a hysterectomy, where the uterus and cervix are removed. The ovaries remain and continue making hormones naturally. Male dogs can have a vasectomy, which is the same as the procedure for men, and they keep their testicles and their hormones. Either way, there are no more unwanted pregnancies, just like with conventional spay and neuter.
Wow, that sounds great. I just adopted Bubba and he's still intact, as they say, because he was a breeding dog. I was planning to get him neutered, but do you think he should get a vasectomy instead?
Well, there are things you should think about. Keeping natural hormones made sense to me for the sake of Maggie's health. The risks of spay and neuter surgery depend on a lot of things, like the age, size, and breed of your dog. Larger dogs and certain breeds may have more health problems if they get spayed or neutered. Big dogs like Maggie seem especially prone to cancers and joint problems, so I made the decision to go with ovary-sparing spay instead of regular spay. I wanted Maggie to have the best chance of avoiding serious health problems like cancer, thyroid disease, hip dysplasia, and urinary incontinence as she gets older.
That makes good sense. Are there any downsides to choosing this kind of sterilization?
There are some benefits to removing the testicles of male dogs and the ovaries of female dogs, because then you avoid any diseases associated with those body parts or with hormones in general. But for many dogs, the benefits of keeping the testicles and ovaries are much greater.
Very interesting. So does Maggie act any differently compared to a dog that has had a traditional spay?
Well, Maggie still goes into heat once or twice a year and acts more interested in males because she has her hormones, but she doesn't bleed during her cycle and she can't get pregnant. And male dogs who have had a vasectomy may still be interested in females in heat, but they can't get them in a family way, if you know what I mean.
This has been so interesting. I can't believe I never heard of these sterilization options before. Seems like they should be standard at all vet clinics.
I agree, but scientists only recently realized the health impacts of spay and neuter. Fortunately, more and more veterinarians are offering ovary-sparing spay and vasectomy, and these options are approved by American veterinary authorities. I'm happy to talk more about this with you anytime, and you can get a lot of info on hormone-sparing sterilization and other pet health topics on the website of the Parsimus Foundation. They even have a directory of veterinarians who offer hormone-sparing sterilization procedures like ovary-sparing spay and vasectomy.
Thanks. I'm so glad we connected today.
Me too. Well, maybe I'll see you tomorrow. Have a great evening, Chris.
You too, Maria.
Want to learn more? Visit parsimus.org/HSS to get information about hormone-sparing sterilization for dogs and find veterinarians near you who offer it.